Everybody, I did want to cover a few more things that I failed to cover in the other videos that are probably things that or questions that folks may have. Um, First of all, I ended up buying some compression socks. In fact, the doctor recommended that because the swelling was so much that they wanted to try to compress that down and get rid of that swelling. Those helped a lot. I bought 6 pairs of them because I'd use a pair a day, one for 12 hours, and then switch off. Um, that helped out a great deal, actually, in reducing down the swelling itself. I also took those with me when I would travel because I did notice that when I was on a plane, occasionally my leg would swell up quite a bit. So I did utilize that on a plane and continue to carry one with me whenever I travel at this point in time. As it relates to braces or some type of a support for the ankle, um, I I do have 3 or 4 different types. One that's just a sleeve that goes over the ankle and the foot area, and that seems to work really well. And then I've also have those that you slide on, and then there's an elastic band that you can tie around it. I use that one as well. I have had the one that and I'm sure you'd see it. A lot of athletes use it, where it's like laces, and you lace it up and tie it off. I tried that, and that really was more of a deterrent in me being able to do things. So I did not utilize that. Tape. Occasionally, I'll tape it if it's starting to be sore, but frankly, I don't use one very often now. I did when I first kind of came out and started to walk. I think that was probably a mental thing as well as a physical thing, but I don't utilize it much anymore. The foot is stiff, so I'm always trying to stretch it out. Move it this way, move it back. Usually do that in bed or if I'm watching TV or something. And so that's one of the things that I would recommend. I did also start utilizing glucosamine, and I take 2 of those in the morning. And I've noticed that has helped. So that may be something for you to take a look at. As it relates to shoes, I did want to show you the Hokas that I had purchased, and this is the Bondi. You can see that's like about an inch and a half of literally of foam, and it's fantastic. I mean, it has really made a big difference for me in my ability to be able to walk. Same shoe size as I normally wore, so that hasn't been a problem. My foot is a little bit bigger. And so if I'm wearing a dress shoe or something like that, I can tell that it's a little bit bigger, but not enough that would cause me to go buy a new dress shoe. Of course, that's just with me as well. Exercise, I exercise and lift weights, walk basically every single day to keep it strong and to continue to work it. I was exercising before as well, so that's nothing new. The As it relates to the screws themselves, I left them in, as I mentioned. My surgeon said you could have them taken out, but he recommended keeping them in. I did that because I just felt that it would make the foot or the heel that much stronger and keep it from having any future issues. Now, photos. I'm going to put some photos up here, so if you get a little squeamish, probably a good time for you to turn away. The first photos that I'm putting up are of these are the basically right after I did a day after actually I did fall, and you can see that there's a number of blisters that had developed at that point, and those continued all the way up the leg. And you can see that it's black and blue around it. And again, it became black and blue all the way up my leg, all the way up my thigh on the back side. There is actually scarring that came out of those blisters. And so I do have scars along the foot and then the back of my leg. So that did end up being something that I had to deal with. And then I'm showing next, these are pictures that were after the surgery, and these are screws that were put in. You can see they're white. There's a variety of them different here. There were 12 different screws that were put in to hold everything together, and you can see that there's a plate as well that was put in there. It looks gruesome, I know, and frankly, when I saw the photos afterwards, I was shocked about how much hardware there was in the foot itself. Again, my surgeon said that it was one of the worst that he'd had to put back together again because of just the complexity associated with it. So hopefully it's not quite as bad for you as to what you may be going through itself. But I would look at what I'm showing here is probably a worst case scenario, at least with my limited knowledge on what went on. Again, I wish all of you success and luck as you begin to go through this challenging time. You will make it through it. It just is going to take time, and give yourself 18 months. You will see marked improvement along the way every 3 months. To begin with, you'll be frustrated, and then you'll start to see some progress, and then you'll kind of slow down, and then you'll see more progress, and then you'll forget about it, and then you'll realize, gosh, you know what, for the most part, life is pretty much back to normal. That was the way it was for me. Now, there are, I'm sure, cases where it's much more challenging and doesn't turn out as well. But hopefully that will turn out well for you. If you have any questions, comments, whatever it may be, put them in the comments below, and I will do my best to answer those, with the knowledge that I have. Again, none of this is medical advice. It's just telling you kind of what I went through. All right. Take care, everybody. Bye-bye.